And vasoconstriction, we all know that it will cause an increased afterload. And an increased afterload is not good for the heart because it will increase the workload of the heart muscle, it will increase the oxygen consumption, and it will increase the oxygen demand. So, if your life has too much stress, you have to control that. You have to get rid of some of your stressors. And I've been telling you, if Med-Surg 1 class is your stressor, get rid of Med-Surg 1 class. If Mr. Verdad was the stressor, get rid of Mr. Verdad. Mr. Steed was your stressor, get rid of Mr. Steed. No, just kidding. Alright, diet. You know what they said, right? If you don't want to die yet, you have to diet. I need to do that too. Anyway, so increased dietary intake of sodium, fats, and cholesterol increases body weight. And if you increase the body weight, then, you know, if you increase the body weight, you're increasing your cholesterol level, your sodium, your fats, and everything will be, will be heavy, and that will cause an increased workload for the heart as well. And remember about the hormones of the female. If the female is getting bigger, premenopausal women are luckier than male. Why? Because if a male is getting bigger, usually our fats will be deposited where? Here in our tummy and right here in our heart. That's why we are more susceptible to develop cardiovascular diseases compared to women before 65 years old. Now, female premenopausal women, if they're getting bigger, because they have the estrogen and progesterone that can help distribute the fats all over the body, and what will happen, if a female is getting bigger, their fats will be deposited where? Right here, on the thighs, everywhere. It will be distributed, all over the body, right? Right here. If you see them in the department store, grocery store, instead of saying hi, hello, they will just say hi, hello, because they don't want to. Anyway, so we have to somehow control our weight, or reduce our weight if we're on that borderline stage of being overweight or obese. Another modifiable risk factor is the activity, your exercises. Lack of exercise, sedentary lifestyle will affect our cardiovascular system. Right? If the only exercise is to lift that remote control, HBO, AMC, what will happen? If you're not moving a single muscle, then most calcium from your bones will leave the bones and it will accumulate in the intravascular compartment. And hypercalcemia, hypocalcemia will cause problem in the cardiac rhythm. Hypokalemia, hyperkalemia will cause cardiac dysrhythmias as well. So, if you don't want to die of cardiovascular disease, get up, go exercise, do something, be active, alright? Next, smoking, alcohol. I know you're getting tired of this, right? But how many times and how many documentaries have we seen, and how many documentaries and documented studies were out there saying that smoking and alcohol, too much alcohol intake, is not good, not just for the lungs, but for the heart, the liver, and the kidneys as well. So, remember, nicotine causes constriction of the blood vessels, and arterial spasm, and increased myocardial oxygen demand, platelet adhesions, and decrease, can you change your PowerPoint? It has to be decrease HDL. So, if nicotine causes vasoconstriction or vasoconstriction, then what will happen? nicotine will cause constriction of the blood vessels, increasing the afterload. And we know very well that afterload is not good because of increased oxygen consumption, increased oxygen demand secondary to increased workload, right? Now, another thing is that the tar of cigarettes can cause hardening of the tunica media of the blood vessels, leading to arteriosclerosis. That's why there were some cigarettes that they specifically says low tar. Why? They want to advertise that they have low tar, so that they have. If you consume that or if you use that cigarette, then you have a less chance of developing arteriosclerosis, therefore less chance of developing cardiovascular disease. But to me, whether it's a low tar or high tar, it's a tar, and it will cause hardening of the blood vessels, right? Aside from the fact that nicotine will cause constriction of the blood vessels. Alright, what else? Type A personality. If you have that type A personality, you're always raising your hand, Mr. Verdad, how about this? Mr. Verdad, how about this? You got to tone it down a little, alright? Why? Because competitiveness, impatience, aggressiveness, and time urgency, it will cause sympathetic nervous system stimulation. Again, it will cause vasoconstriction, increasing the afterload. You will die. Alright? Just kidding. Alright. Oral contraceptives. Oral contraceptives, most oral contraceptives can precipitate thromboembolism and high blood pressure. So therefore, why high blood pressure? These oral contraceptives contains steroids, and you know that steroids will reabsorb sodium, and if you reabsorb sodium, you will be retaining water. If you retain the water because you're taking oral contraceptives for a long period of time, if you're taking steroids for a long period of time, it will cause retention of fluid, you will gain body weight, and retention of fluid will cause hypervolemia, and hypervolemia can lead to an increased preload. Remember, so if I have a weak heart, cardiomyopathy, congestive heart failure, I cannot take oral contraceptives because that will lead to increased intravascular blood volume, increased preload, and that will not be beneficial for my heart, right? So, of course, high blood pressure. So these are your modifiable risk factors. Stress, relax, get rid of some stressors, of your life. Dietary intake of sodium, fats, and cholesterol, you have to control the diet. Exercise and activity, you have to get up, run, walk. It doesn't matter. You need to burn calories. You need to exercise your bones. Habits, vices, alcohol, smoking. That's the reason why in the hospital right now, if a patient came in and the patient says, I'm a smoker, it will always trigger, another response from the nurse. You will have what? You will always give them the quit smoking pamphlets or smoking cessation brochure. You may advise the patient to wear nicotine patch while the patient is in the hospital. Things like that. Because, oh, by the way, Jefferson County is supposed to be a smoking-free county. I think I already mentioned that to you. Alright, type of personality, if you're highly competitive, you're always on the go, you're aggressive, again, remember, it will cause high blood pressure because of the sympathetic nervous system stimulation. And you may not feel it immediately, but time will come, it will have a deleterious effect in your cardiovascular function. And of course, contraceptive pills, simply because contraceptive pills contains steroids. Steroids will reabsorb sodium. Steroids, once you reabsorb sodium, you will be retaining water. And not to mention that contraceptive pills increases the risk of platelet adhesions causing thromboembolism. Okay. Alright, so next, let's do the physical examination. So we have done our interview. We have asked the patient about the personality, the demographics, you know. Let's look at the general appearance of the patient, you know, the physical examination. So check for the general appearance. The level of consciousness of the patient is very, very important. If the patient seems confused, then that could be a sign that the brain is getting less oxygen. And that could mean that the problem is not really up here, but it's right here. Remember I told you, you know, the heart can survive without the brain, but the brain will not survive without the heart. So again, check the build of the patient. Is the patient, you know, malnourished? If the patient is malnourished, then that could be a sign again of, you know, decreased tissue perfusion, not just to the vital organs but in the periphery as well. Vital signs: skin color. Skin color, if you notice some kind of cyanosis, peripheral cyanosis, circumoral cyanosis, or differential cyanosis, then that could be a sign again of, well, obviously that's a sign of decreased tissue perfusion. Temperature, if the periphery, or the, let's say the periphery of the arms, the lower extremities are cold, then that could suggest decreased tissue perfusion in the periphery because of decreased blood supply. Vital signs: blood pressure, respiratory rate, pulse rate. We have to check that. Any increase could suggest cardiovascular problem. You know, an increase in the blood pressure, an increase in respiratory rate could suggest, you know, compensatory mechanism. An increase in the pulse rate or the cardiac rate could suggest again compensatory mechanism, such as in the case of anemia, such as in the case of you know, low cardiac output, or any type of narrowing of the blood vessels, or such as in the case of hypertension. Jugular veins, distension of jugular veins could suggest, again, remember, right-sided heart failure, because blood will back up to the superior vena cava. And of course, well, we'll talk about the CVP later. That's central venous pressure. Carotid arteries, check for bruits and pulsations. Chest, check for the heart sounds. Remember, I told you about the auscultatory areas of the heart, right? If you want to hear the aortic sound best, if you want to hear the aortic sound, you have to put your stethoscope on the second intercostal space, right sternal border. Pulmonic sound is second ICS, left sternal border. Herb's point is third or fourth ICS, left sternal border. Tricuspid is fifth ICS, left sternal border. And mitral should be the point of maximum impulse, right? Midclavicular line, fifth intercostal space. Now, if you don't hear your mitral sound in the fifth ICS, left midclavicular line, instead you're hearing it right here on the fifth ICS anterior axillary line, or in the sixth ICS, then that could suggest not just the displacement of the heart, but it could suggest cardiomegaly, or enlargement of the cardiac muscle. That happens a lot in case of congestive heart failure, of course. Extremities, peripheral edema, capillary refill time, clubbing of fingers. These all suggest problems in tissue perfusion. And peripheral edema, you know, is always associated with right-sided heart failure. The lungs, check for breath sounds, coughing. If the patient is having pulmonary edema, remember, blood will back up to the lungs. Patient will complain of shortness of breath. You will hear crackles, not on the bases. It will be on the apices, right? On top, or right here. And then abdomen, any enlargement of the liver could suggest right-sided heart failure, because again, if blood backs up to the inferior vena cava, it can cause ascites, it can cause hepatomegaly, it will also cause edema of the periphery. And of course, bladder problems, alright? So, we talk about this. Sorry. Again, this is the aortic sound, the pulmonic sound. You have the Herb's point right there. Fifth intercostal space, left sternal border. is your tricuspid, mitral is pit intercostal space, left mid-clavicular line. Okay, don't worry about this. We're not doing that anymore. Lab tests or diagnostic examinations. What are the things that we need to understand about this? So, the most common lab tests and diagnostic exams associated with diagnosing cardiovascular disease, of course, will be your CBC, the lipid profile, cardiac enzymes, and blood coags. Let's dissect this one by one. These are your CBC parameters, alright? First, of course, CBC will include the RBC, the WBC, RBC 4.5 million to 5.5 million per cubic millimeters per male, 4.5 million to 5 million per cubic millimeters in female. WBC is anywhere between 5,000 to 10,000 per cubic millimeter. So if the patient is having WBC count more than 10,000 per cubic millimeter, that always suggests infection. If the patient has a WBC count of less than 5,000 per cubic millimeter, then it means that the patient doesn't have enough cellular soldiers that can protect the body from infection. So you have to put the patient in reverse isolation technique because the patient will be susceptible to infection. Platelets is anywhere between 200 to 400,000 per cubic millimeter. If the platelet counts falls below 200,000 per cubic millimeter, then that suggests that the patient will be susceptible to bleeding. You have to protect the patient from bleeding. Check all the orifices because that you will see if the patient has bleeding tendencies, you will see bleeding in all the openings of the body. You will also, of course, you have to check the what am I saying? The PPINR of the patient, and then hemoglobin 12 to 16. Can you change that? Male has 14 to 18, female has 12 to 16, and hematocrit is 40 to 54% for male, 31 to 47% for female. Again, like I said, any decrease will suggest in hemoglobin count. Any decrease will suggest problem in the oxygen carrying capacity of the blood. And in hematocrit, if there is a decrease in the hematocrit level, again, most likely your doctor will be ordering for blood transfusion of 2 units PAC RBC. Okay? Now, RBC usually decreases in rheumatic fever, infective carditis, anemia, increases in heart disease. WBC increases infections and inflammatory diseases of the heart. Hematocrit increases in hypovolemia. So if the intravascular blood volume is markedly reduced, then blood will become more viscous. And the more viscous blood you have, the more hematocrit you have. Hemoglobin, of course, is down in all types of anemias. ESR, what is ESR? ESR stands for erythrocyte sedimentation rate. And this is a measurement of the rate at which RBC settles out at the bottom of the test tube. Right? So, male is 15 to 20 millimeter per hour. Females, you have 20 to 30 millimeters per hour. And this will increase in infectious heart disorders and, of course, in MI. Lipid profile, this is what I love. Total cholesterol should be less than 200 milligram per deciliter. LDL should be less than 160. Your HDL should be greater than 40 milligram per deciliter. Triglycerides should be 150 milligram or less than 150 milligram per deciliter. I told you how much my triglycerides were, right? Yeah. Any increase of this LDL, triglycerides, total cholesterol can lead to or can increase the risk of the patient in developing coronary artery diseases. Alright? And what is your most important responsibility if the patient will need to have lipid profile. Of course, if the patient will need to have lipid profile, you need to put the patient NPO for about 6 or maybe 8 hours before you draw the blood specimen. And a lot of doctors will order this. They will put an order, let's say, lipid profile in AM. Some nurses do not fully understand. I don't know, maybe it's it's laziness on their part sometimes. But if the doctor says lipid profile in AM, they will put the patient NPO post midnight, and then they will draw the blood at 12:01 because that's AM. Well, that's not going to work because the patient has to fast for about 6 hours or 8 hours before you draw the blood to have an accurate result. If not, then you will have a false positive result of your sorry of your lipid profile. So blood CS, this assists in diagnosis of infectious diseases of the heart, pericarditis. What do you need to do? You have oh God, sorry. For blood CS, blood culture and sensitivity, I don't know if you have done this before, but one set of blood culture and sensitivity will need 2 bottles, alright? You need one aerobic bottle and the other one should be anaerobic bottle. So if the doctor ordered for blood culture times 2, you need 4 bottles actually. 2 anaerobic and 2 aerobic bottles. And if the doctor says you need to do it times 2, then you have to stick the patient twice because you have to get one specimen from one arm, another specimen from the other arm. Now, if the patient has central line, then you can get one set of specimen from the central line. The other specimen has to be from stick. Cardiac enzymes. What are these cardiac enzymes? Of course, you have troponin. These are cardiac markers, and especially troponin. Troponin is very cardio-specific. You will not have an increase of troponin unless you have damaged myocardial tissue. You have CKMB or creatine kinase myocardial band. You have total CK, and of course you have myoglobin. And I told you about the troponin. A lot of times the doctors will order for serial troponin, and when they say serial troponin, they want you to get troponin levels at 3 times at 4 hours interval. So if the patient came in at 0700, complaining of chest pain, you will get troponin 1. Your troponin 2 will be at 1100, right? And then 7, 8, 9, 10, yeah, 1100. And then your troponin 3 will be at 1500. 12, 1, 2, 3. So 1500, and why is that? Why do we need to do that? Because a lot of times troponin 1 will not be significant yet, especially if the patient just had the chest pain, and that troponin level will not go up in the blood until about 6 hours, 4 to 6 hours after myocardial tissue damage, right? And that's why they want to see the trend. So these are your troponin, total CK and CKMB. Your troponin level should be less than 0.4 nanogram per ml. Total CK 38 to 120. CKMB should be 0 to 3 nanogram. Myoglobin should be less than 90 microgram per liter. Your blood coags. When we say blood coags, we're talking about the partial thromboplastin time, or the PTT. And you have the PT, or the prothrombin time, and you have the APTT, or the activated partial thromboplastin time. The prothrombin time is usually used to evaluate response of the patient to Coumadin therapy, while the PTT, so PT is usually associated with warfarin or Coumadin therapy, while the PTT is usually associated with, or the PTT is being used to monitor the the effectiveness of the heparin therapy. PT measures the time required for clotting to occur after thromboplastin and calcium is added to the decalcified plasma, usually 9 to 12 per second. And, they will usually have this INR 2 to 3.5. A lot of doctors want an INR of above 2.0. So if the INR is higher than 3.5, means the blood is thicker. If the INR is less than 1 or is less than 2, then the blood is thin. PTT measures required for clotting to occur after PT reagent is added to the plasma, normally 60 to 70 per second. And this is the best single screening test for coagulation disorder, especially if the patient is taking heparin. By the way, I'd like to emphasize, your Lobinox is a low molecular weight heparin. So, Lobinox is also a heparin. Okay, don't worry about that INR right there. This is your BUN, your blood urea nitrogen. The blood urea nitrogen is the best indicator for renal function and tissue perfusion and glomerular filtration. Normally, the BUN should be between 10 to 20 milligram per deciliter. This will be elevated when cardiac output is decreased. So, if the cardiac output is low, then what will happen to the blood urea nitrogen? The kidneys won't be able to produce much urine. If the kidneys cannot produce much urine because of decreased tissue perfusion secondary to decreased cardiac output, then BUN will be retained. The blood urea nitrogen that needs to be eliminated will be retained, causing an elevation. So in case of myocardial infarction, congestive heart failure, and even with acute renal failure and chronic renal failure, you will have decreased cardiac, any condition that can cause decreased cardiac output can lead to increased BUN. Alright, I guess I will stop right here in the laboratory examination. Tuesday we will be talking about all the non-invasive procedures. Okay? Thank you very much. You have a good weekend. I'll see you on Tuesday. Bye-bye. By the way, all the tests for Tuesday will include everything about cardiovascular system, including all the laboratory examination. All right. Bye-bye.